Anemia. Anemia occurs when the body does not have enough healthy red blood cells or when the amount of hemoglobin in the blood is low. The red blood cells in the blood carry oxygen throughout the body. A protein called hemoglobin allows the red blood cells to absorb and release oxygen. Without enough red blood cells or hemoglobin, the body doesn't get enough oxygen. Symptoms of anemia may then occur. Symptoms. Some people with anemia have no symptoms, but most people have symptoms that range from mild to severe. These can include tiredness or fatigue, weakness, headache, hair loss, brittle nails, uncommon or unusual food cravings, shortness of breath, dizziness or fainting, rapid, slow, or uneven heartbeat, a whooshing or pounding sound in your ears, cold hands and feet, trouble doing normal amounts of activity, and pale or yellow skin. Causes. Anemia can occur when the body loses too much blood, does not make enough red blood cells, destroys the red blood cells at a faster rate than it can replace them, and does not make a normal amount of hemoglobin in the red blood cells. These problems can occur due to many reasons, including a condition that a person is born with, congenital or inherited. This includes sickle cell disease or thalassemia. Heavy bleeding for any reason, including injury, surgery, childbirth, or even heavy menstrual periods. Being low in certain nutrients such as iron, folate, or vitamin B12. This may be due to poor diet. Health conditions like inflammatory bowel disease, cancer, rheumatoid arthritis, or kidney, liver, or thyroid disease. And exposure to certain medicines such as those used for chemotherapy. There are different types of anemia. Your healthcare provider can tell you more about the type of anemia you have and what may have caused it. Diagnosis. To diagnose anemia, blood tests are done. Your healthcare provider will order a common blood test called a complete blood cell count, or CBC. This test measures the number of the different types of cells in the blood. Depending on the results of the CBC test, other blood tests may be ordered. In some cases, a bone marrow aspiration may be done to help confirm the cause of anemia, or if another health condition is suspected. Treatment. Treatment for anemia is based on the type of anemia, its cause, and the severity of your symptoms. Treatments may include diet changes. This involves increasing the amount of certain nutrients in your diet, such as iron or folate. Your healthcare provider may also prescribe nutrient supplements. Medicines. Certain medicines treat the cause of the anemia. Others help build new red blood cells or relieve symptoms. Blood transfusions. Replacing some of the blood can increase the number of healthy red blood cells in the body. And surgery. In some forms of anemia, surgery may be needed to treat the underlying cause of anemia. If surgery is needed, your healthcare provider will explain why it must be done. He or she will also explain the procedure and outline the risks and benefits for you.